Good morning and welcome to this webinar on student health and well-being. My name is John Ballard. I'm the Associate Vice Chancellor for Student Health and Wellness and the campus's Chief Wellbeing Officer. I'm happy to welcome you this morning. The fact that so many of you are here, north of 350, I'm told, is testament to how important this topic is, especially at 8 o'clock on a Monday morning. I'm happy to start by introducing a video from our Vice Chancellor for Student Affairs and Success, Dr. Akira Bradley Armstrong, who unfortunately is traveling but wanted to do a welcome video for you.
Good morning, families. My name is Dr. Akira Bradley Armstrong, and I am the Vice Chancellor for Student Affairs and Success at UC Santa Cruz. Thank you so much for taking the time to be with us here this early morning at 8 a.m. This is our first Ecosystem of Care Coffee Hour, and our topic this morning is wellness. We know that at this time of year for our students, as they're hitting midterms and finals and closing out this quarter, sometimes it gets a little challenging. So we wanted to make sure that we had some staff who could talk to you about what are some of the challenges our students, your students, may be going through and how you might be able to support them, and also what the research is saying. And so we are very excited to be able to present this webinar to you, and we hope that you get a lot out of it. Thank you for joining.
Thank you so much, Vice Chancellor. Again, the importance of student health and wellness can't be overstated, both for their academic success, of course, but also for their relationships in the world, for who they're becoming as adults. And I want to start by saying that if you're here this morning because your student, our student, is struggling with health issues, either physical or emotional, first of all, I'm very sorry that they're going through that and that you're going through it. And I want to assure you that Student Health Services is here for your student. Our whole reason for being is to help your student be well. We're going to use our time in two ways this morning. The first is a bit of an overview presentation about Student Health Services in response to questions we receive from you in advance. The second half will be a panel discussion and Q&A with our senior clinical leadership here at Student Health Services to respond to some of those other questions. Let's jump right in. I'm sorry about that. So who we are and what we do at Student Health Services. But sometimes people think of student health in the old school nurse model. I want to tell you that we are, first and foremost, a comprehensive care center. On the primary care side, we offer a comprehensive outpatient clinic with a full pharmacy, radiology, and laboratory, some specialties like optometry and women's health. We see about 200 patients a day in our same day and pre-scheduled clinic with physicians, nurse practitioners, RNs, and medical assistants. We are CAPS, Counseling and Psychological Services, that offers a full array of services, both individual and group. We are psychiatry and case management for students in need of higher acuity services, and also case management serves to assist students in finding the resources that they need. We are SHOP, Student Health Outreach and Promotion, a group of professionals and a large group of student peers who fan out across campus at events and tabling opportunities to share health and well-being tips and information with students. We are CARE, the Center for Advocacy, Resources, and Empowerment that provides support for faculty, staff, and students who are the victims of sexual violence or assault. We are the COVE that provides services to students in recovery from alcohol and other drugs. And we are the Mobile Crisis Unit, which provides after-hours care and behavioral de-escalation. And I'll talk more about that momentarily. Starting with primary care, these are the main reasons and/or diagnoses that students come to us for, and it runs the spectrum from immunizations and contraception to basic things like sore throats, upper respiratory infections, urinary tract infections, and sexually transmitted infections. They come to us with dietary concerns, for physicals, and interestingly for anxiety. And this last one may be a surprise to you that it's coming up in primary care. But given the increase in issues related to stress, anxiety, and depression that we're going to talk about in a minute, it is not surprising to us to see them manifest themselves in students' physical health. These are some numbers in terms of our 22-23 fiscal year, academic year. Our pharmacy filled over 20,000 prescriptions. And in combination of in-person and telehealth visits, we saw over 20,000 visits in our primary care clinic. We had 10,000 lab collections and about 2,000 x-rays in last year because students tend to hurt themselves on skateboards and e-bikes. A number of the questions had to do with SHIP and what services are available to non-SHIP students and cruise care. So I want to go over that just very briefly for you. Every student at the University of California, as you know, is required to have health insurance. And we have our own plan, which is called SHIP, or Student Health Insurance Program. It is just like any other comprehensive care program. It is considered a platinum program with the Anthem network supporting us. It is self-funded by the University of California. There are low to no out-of-pocket costs for your students for services received here at the Student Health Center, low copays for specialty services, and low co-insurance. And even at the pharmacy, their copays are lower than if they go out into the community. We also coordinate their care and act sort of like an HMO PPO combination, where we will refer them out for all specialty care that they might need. Those who opt out have the opportunity to purchase an access plan, which is called Cruise Care. Students can purchase this, or you can purchase this at the time that you're waiving out of SHIP Online, but they can also purchase it at any time during the year. And it provides free of additional cost basic services like visits, laboratory, some labs that they need to take, and also x-rays. And honestly, the cost, if a student comes in and needs a lab, x-rays, or a visit, will exceed the $125 quarterly cost. So we encourage students who waive out to purchase Cruise Care. But even if your student has opted out, and about 55% of students purchase SHIP, and an additional 2,000 purchase Cruise Care. If your student is not one of those, they can still come to us for services. They can still get prescriptions filled. They do have an out-of-pocket expense, and for many plans, they can submit detailed invoices, which are available on our website, to their insurance companies for reimbursement. I want to again assure you that regardless of insurance or ability to pay, we are here to provide services for your students. That gets us into mental health services. And I know a lot of the reasons that many of you are here today are for this scope of services. Last year, students had nearly 14,000 visits with therapists, case managers, or psychiatrists. And this number at the bottom may be the most surprising statistic that you hear today, that we have seen an 87% increase in demand and utilization of counseling, case management services, and psychiatry since the fiscal year academic year 18-19, which was the last full year before COVID. That 87% represents both an increase in acuity and stress and anxiety related to everything that you're aware of, whether it be politics or finances or struggling with issues of young adulthood. But it is also because the stigma of getting services for mental health have decreased. These are the top concerns of college students around the country in response to a very credible survey done by Healthy Minds. When our senior leadership looked at this here at Student Health Services, they confirmed that these are the same kinds of numbers and statistics that we see here on this campus, with the exception that anxiety is higher than this and perhaps exceeds depression slightly. But if you look at this, some of these numbers will undoubtedly be concerning to you. that during some time of their college career, north of 40% of students say that they have experienced depression. A similar number have experienced stress and anxiety. About 15% struggle with an eating disorder sometime during their college career, and 15% have suicidal ideation. Of concern is that nearly 30% engage in non-suicidal self-injury. The good news is that about 35% participate in services and seek out services. And these last two get to that sense of stigma that I mentioned. The bottom one, when parents are surveyed and the public is surveyed about what they think the stigma is, about 40% of them still think that there is a high stigma related to getting mental health services. But the line above it is college students. And you'll see that only 5% of college students think that there is a stigma related to receiving mental health services. That is so important, and it's such a big advancement because it means they're coming to us for services. This last one is also parent perception, and you'll see that when asked, parents think that about 20% of students experience depression, when that number, as we've seen, is closer to 40. Similarly, about twice the number of eating disorders, 3 times the number of suicidal ideation, and a similar almost half of substance abuse disorder. This is not to say that parents are out of touch or don't know what's going on with their students. What it is to say is that students are getting help. That if we're seeing these kinds of numbers, it means that students are taking advantage of services and are seeking the help that they need. And that's very, very good news. I want to speak just briefly about Mobile Crisis Team, because all 10 UC campuses were required to launch this service. UC Santa Cruz was the first. It is a group of professionals that have a van. Soon we will have a second team with a second van who are available up until midnight each day to go out and respond to students who are in some kind of crisis on the behavioral health side. They are trained professionals in de-escalation and crisis intervention. They will go out to students who are experiencing some kind of crisis. They will assess them. If they need additional services, they will facilitate that service. And they will do wellness checks. If our therapist thinks that a particular student is in crisis, they will ask the Mobile Crisis Team to do checks on them in the evenings and weekends. And that has proved especially helpful in staying on top of issues that particular students are facing. That just covers the tip of the iceberg in terms of services and issues that students are facing, but I hope that it gives you a good overview of the kinds of things that your students may be experiencing and struggling with, or if not them, their friends and roommates and colleagues. If you should have other questions that we're not able to get to with our panel, please do email healthcenter@ucsc.edu. That email will be directed to the appropriate person, and we will get back to you in response to your questions. Now we're going to switch over to our panel discussion. And we have 3 panelists with us today. Dr. Elizabeth Miller, our medical director, Dr. Mary Jan Murphy, our CAPS director, and Dr. David Lowe, our psychiatry director. All of them have many years of experience dealing with this age group and in student health services. And I will tell you from a personal perspective, having worked in student health for more than 15 years, I have never worked with people who are as caring and as capable and competent as these 3. Your students are in very, very good hands. So we will now go to these panelists. I will present them with questions that you all submitted prior to this. If there's time permitting, we have folks who are paying attention to the Q&A, and you can enter additional questions there. And if time permits, we'll get back to them. If not, they will be forwarded to us for later response. I'd like to start out with Dr. Murphy, our head of CAPS services. with this question. What signs should parents look for that might indicate their student is in distress or struggling with issues related to stress, anxiety, or depression? Mary Jan?
Yeah, thank you, John. I think that's a really, really important question because as we know, all of you in the audience, parents, families, you worry about your student when they come to college, and it's normal to worry about them because there's such a transition with regards to being a new student, coming to a new area, dealing with all the stressors that John described. So there's a couple of things that we would like to point out that could be helpful for you just to pay attention to. And if you do see those, to actually have a conversation with your student. So a couple of factors that we want to point out is one, if your student is telling you things like, I'm missing classes, I am not making any of my assignments, they're not getting completed, or I'm really, really distressed about the significant increase in load that I have as a student as compared to high school or as compared to community colleges. Those are some things that you might want to be listening to and think about you might want to talk to your student about and share your concerns. Some others are what we call changes, sort of marked changes in behavior or marked changes in their emotional state. Maybe they tell you that they're just not eating as much as they used to because they're so stressed, or maybe they're gaining weight, or maybe they're talking about they're just excessively fatigued. Maybe they're also talking about using drugs or alcohol. And also, one of the things that John mentioned is sometimes I tell you they're anxious all the time, or you notice they're in fact much more irritable or angry than they might have been in the past. So those are some changes in behaviors we want to point out to you. Some other things that are important are the social cues. Are they disengaging? Are they very isolated? Have they been somebody who totally had communication with you and have totally stopped? Are they talking about breakups in relationships? We know that breakups at the college time significantly stressful. And then the last thing that I want to mention, or two last things that I want to mention. One, if they ever express to you that they want to hurt themselves or are hurting themselves, those are clearly red flags that we want to pay attention to. And last, as we know, our students use social media continuously. And so you might be someone who sees this. And are they saying, concerns about behavior, concerns about their future? Are they being hopeless about future? They don't think that things can change. Those are some more cues that you want to pay attention to. And I think what's really important is you're hearing things that they're saying or you're observing behaviors, and those you want to share with your student and say how concerned you are about them. Thanks, John.
Thank you so much, Dr. Murphy. This one is for Dr. Lowe, again, our head of psychiatry. David, how might parents begin a conversation with their students about these kinds of issues, especially if there's not a level of communication with them that might encourage such conversation?
That's a very relevant question because I had that conversation with students, as my patients, but I also have a couple of college kids myself, and I know how hard it is if you don't have that history, you don't have the language, and it's awkward and it's scary. I like to be real practical. I think it's real important to be descriptive, describe very practical things that you're seeing, that you're concerned about. And first of all, just acknowledge that this is a difficult, weird conversation for us to have. But here are the things that I'm seeing, and I invite you to give me your feedback with it too. In psychiatry, we really kind of touching what Dr. Murphy has said, we always touch on the basics, sleep, nutrition, energy levels, concentration. So these are things that if your child is not doing well, you will have noticed changes in. So I think it's real important to just point out practical, objective changes that rather than going to the emotional states right away. Of course, emotions are part of it, but that's much more vulnerable state. To talk about somebody who's not sleeping at all, which is very typical, or oversleeping, not eating at all, or under eating, not having the same energy to do the things that they enjoy. That's a much easier entree into that topic about what may be going on. But I think, first of all, just to show your cards that this is awkward, this is scary, this is weird for us to talk about. This is probably making you uncomfortable, but that's okay. I'm uncomfortable too talking about it. Just to show your cards and start the discussion that way. Hopefully it warms up and it becomes smoother as the discussion goes on.
Thank you so much, David. Dr. Miller, again, our medical director here in primary care services. Can you talk about how students get receive services after hours when we're closed? And I might just ask the panelists to mute yourselves when you're not responding to questions. Dr. Miller?
Hi, good morning. Yes, so first of all, we have a nurse advice line that operates 24/7, even over holidays. And so the students can call to get medical advice. If the problem can't wait until the next day that we're open, then they're instructed to go to either a local urgent care center or to it's usually Dominican Hospital emergency room, but if they're if they're somewhere else, a local emergency room. And then another option is to use Live Health Online, which is a telehealth service that we offer our students, and it's a 24-hour service. And then the next business day, we do go over all of the night nurse calls and ER visits, urgent care visits, and we make sure that we make contact with those students and make sure they're doing okay and that they were able to get the care they need. And if not, we offer them an appointment.
Thank you so much, Liz. Dr. Murphy, the same question to you. In after hours and weekends, in addition to the campus mobile crisis team, what kinds of resources are available when we're closed?
Yeah, we also have a same service of after hours from 5 p.m. through 8 a.m. and then on the weekends and the holidays of a crisis call center that our students can call when they're in any type of crisis. And they can get some support over the phone. And then what will happen, just like Liz talked about in the morning, we will then be notified about students who have called, and then we will follow up with those students who are in crisis. In addition, there are local community centers that if a student is in a mental health crisis and they need to go to a hospital, or if they need to go to our local crisis stabilization program, they can do that as well. And last, I want you to know on our website, we have there are very many crisis lines throughout the country, not just our crisis line, which is what we do refer students to, but there are also other crisis lines that student can use for services for themselves after hours. And ours, I want you to know, is also available for parents and family and faculty and staff who want to call because they have a concern about a student. So you may call as a parent and say, I'm not sure what to do. Could you give me some ideas? So we also have that service as well for parents.
Thank you, Mary Jan. Can they get that phone number from the website?
They can. It's the same number as the CAPS main number, and it is on the website, yes.
Thank you so much. Dr. Miller, this is for you. The question about what kinds of services are available for our trans students on campus?
Oh, okay. Yeah. So first of all of our staff are trained in gender recognition and live name, and just in trained about some of the unique issues that are involved when a student is transitioning or they have transitioned. So we have trained staff here, and we offer hormone replacement therapy injection training to teach students how to use, how to inject themselves. We have comprehensive lab panels, including hormone levels. We do run our own testosterone levels here on site, and so we get the same day result for that. We also have excuse me, support. We have case management support, CAPS, the Cantu Center. And, just in general, we try to have a welcoming environment for the students who are seeking gender affirming care.
Thank you so much, Liz. Dr. Lowe, this question is for you. When my student was in high school and was experiencing some stress, I used to call their teachers and talk with them. And I noticed that among my students now, but I don't feel comfortable calling their professor. How do I deal on the academic side, do you think, with my student who's not doing well? And I think it's related to some of the academic stress they feel. You're on mute, David. I'm sorry. Maybe I should undo the request with people
Yeah.
mute. Sorry, go ahead.
That's a great question. It's totally understandable that concern about their mental health and about their academics and how the two are related. I think in this college age population, it's best to go through the student to respect their autonomy. Back to the conversation that you should have with your child. If you let them know that you're respecting their autonomy and their choice making, but here are your concerns, and you can encourage them to talk to their professors, and let them know that student health in whether it's the primary care side or the mental health side, we are here to back them up, that they can go to the professors, with support from us. Hopefully that would embolden them to do so. From something as simple as just a note from one of us saying that they've been sick this week, physically or mentally. They may be late on their assignments. Professors are very responsive to that, most of them. So they should feel free to tap into the university resources, but do reach out to the professor themselves, through email, through office hours. If your child won't do that, then you can always reach out to us and let us know about your concerns. But usually, unless there's a drastic circumstance, usually we would not reach out to academics on our own without the student's permission. We would try to engage a student and have them communicate that as well.
Thank you, David. That's very helpful. Dr. Murphy, this one is for you again. My student is BIPOC, so Black, Indigenous, or other person of color. But I understand that there are not enough therapists of color at UCSC, and I wonder if you could tell me what's being done about that.
Sure, I think this is such an important area. I mean, first, I would like to say that all of our CAP staff are trained in culturally appropriate care to be able to serve students with diverse and intersecting identities. So that's a really important foundation for our staff. But I do think, as we know, that for some students, it can be very, very helpful to have therapists who represent diverse and intersecting identities, because it may be easier for them to see those therapists as they think they may be understood, because they may share lived experiences. So that is a really important piece that we are working on very, very hard. And first of all, for you in the audience, if students go to our website, they see bios of all of our providers, and the providers talk about their identities and describe who they are, which then makes it a little easier for students in terms of preferences. And in the initial meeting that we have with students, what happens is, if we feel like that's a really important match, we will talk about that with the student, and we will get another therapist on board to be able to see them if that match didn't happen in the initial contact. I also want you to know that we have 2 online services that we use for our students, because there are such high mental health needs, as John showed in his PowerPoint. We have something for students who do have SHIP that is called Lyra. And Lyra allows a student who's going to be getting off-campus therapy to choose a preference for their identity of their therapist. We have another program as well, another online service, and you can do that as well. And to get to John's specific question, what is being done? We are very excited that we have had just a new staff member accept a formal job offer with us that specializes in working with Asian and Asian American students and international students, and is Mandarin speaking. So we are continually trying to expand our staff. We have what we call multicultural mental health therapists and psychologist jobs being advertised, and we are interviewing for those right now. And the last that I would like to mention that what we offer for students is, in conjunction with our division, we work in collaboration with a group called Black Girls Doctor, as well as On the Margins. And both of these programs offer coaching to students with particular identities. And that's a really, really important match that can be providing students with some support. And we, at a creative level, John and I are working on salaries and remote work and lots of different flexibility to be able to attract and hire therapists with diverse identities that represent our student population.
Thank you so much, Mary Jan. Dr. Miller, can you talk a little bit, having worked in student health services for a lot of your career, What have you seen changed on the physical health side, primary care side? Are you seeing differences now than you've seen in the past, or what do you think are the main concerns for students beyond sort of what we said in the PowerPoint?
Well, I mean, it really is what you said in the PowerPoint, though, because it's a lot of mental health issues, and some of them have physical manifestations. So a very common thing that we see is insomnia, and often that's related to anxiety, something that the students are worrying about. Sometimes, we see a lot of people with basically stomach and gastrointestinal problems. So nausea, vomiting, diarrhea, stomach cramps, change in their stools, and that always, takes some time to sort out. And sometimes it can be because of anxiety, some of the symptoms, and a lot of times it's not. So it's those we see a lot. In addition to what you've already talked about, but just in general, lots of accidents, to bike accidents, especially e-bikes and skateboard, and then motorized scooters. So we just try to make sure the students know they should wear helmets and be extremely cautious when they're riding anything around campus.
Thank you so much, Liz. Dr. Lowe, can you talk about students who need longer term care that may be higher acuity and have seen a psychiatrist while they're in high school, or a therapist, and the parents really believe they need longer term care? Can you talk about what we offer here for that and what other options students have?
Sure. So if they are taking psychiatric medications already, the psychiatry services here at UCSC are long-term. We often see students for a year, 2 years, 3 years, 4 years, or grad students 8 years. So there's no worry about that. Psychiatry is open-ended, and we will stay with the student as long as they are a student here and that they're appropriate for our level of services. For other treatment modalities, individual therapy, group therapy, that is tricky. We have limited resources here on campus, and we often refer off campus. And there's so many options. There's telehealth as well. So it's a big world out there to explore. This is my pitch for case management, and this is what I do. I have some ideas always of where to point people, but case managers stay on top of it. So come on in, and either through primary care, or through psychiatry, or counseling, ask for a case management appointment. There's drop-in hours also for case management, and they can easily get that help from a case manager to find the resource that they want, whether it's an in-person therapist, whether it's a telehealth appointment, whether it's a group, whether it's a higher level of care. There's intensive outpatient and partial hospitalization programs out there that are also both telehealth and in person. So case managers are a great practical resource for us and for your student.
That's really helpful, David. Thanks. And Dr. Murphy, maybe it'd be helpful to just give a little bit of explanation about the range of services available in CAPS.
Be happy to. And I think what John is saying is there's a range of services. What we want everybody in the audience to know is that students need different things with regards to mental health. Some need individual appointments. Some need to just get on the website and read about how to manage their anxiety. Some need psychiatry, etc. So I want to tell you a little bit about the range that we have. And I want you to know that what we try to do is have different entry points for students, because sometimes it's much easier to go to Dr. Miller in the health center and she gives a PHQ-9 and the student's depressed, and then she sends them back to CAPS than it might be for them to come into the counseling center. So we have what we call a step care model. So at one level, we have all these types of resources on our website where students can learn and read about different ways of managing their mental health. We have all these links to mental health apps. That very much fits our students using apps to manage their sleep, to manage their anxiety, to manage their stress. We also have what we call virtual anxiety and mood toolboxes. As John showed, those two main concerns of anxiety and depression are what our students experience. They can get online on the CAPS website at 2 o'clock in the morning, and they can practice skills about how to manage their anxiety. Something that's also too that I really want to mention that people don't know about that much is something called, we have peer educators, and they provide these pep talks. And sometimes it's much easier for a student to go talk to another student than it is for them to come talk to a mental health provider. And then once they talk to that student, then the student may say, oh yeah, CAPS is good, go on and go to CAPS. We also have something called Let's Talk. And Let's Talk is a non-appointment, non-scheduled, don't even need to say your name type of meeting for 20 minutes or so, where a student can go and just say, I'm struggling with my roommate. I'm struggling with my classes. I'm struggling with knowing how to get connected with people. And they get a little help. And then they may decide at some later point, they may want to go to therapy. And then, as David was mentioning, we have the more traditional counseling services as well. We have drop-in groups, therapy groups. We find groups are very, very helpful for students to find out they are not alone. And we have groups focused on issues like loss and sexual assault and depression, to general groups that focus on just, undergraduate students or women or men. And we have group for students who identify as neurodivergent. And we have groups around identities like Black Minds Matter and a variety of groups like that. Those are very, very important. And then we have the individual therapy, the very traditional individual therapy. We do brief individual therapy. And as Dr. Lowe mentioned, if a student needs more ongoing or long-term care, then we get them connected with our great case management team, and they will refer them to other services off campus. And then we do have same-day crisis service. And then for any student who's in crisis during the day, and then as we talked about, the after hours phone. And the one thing I want to mention about the mobile program that John mentioned, the campus mobile program, is it is for people who are on campus, for students who are on campus. But if your student lives off campus, but is on campus and is having a panic attack, is having a really distressing moment at that time, they can actually call and use that mobile crisis program. So that's really important. And the last thing that gets very confusing for our students, we found out, is that they think that if they don't have cruise care, they can't use CAPS. Students can use CAPS regardless of what type of insurance they have. So I think that's, John, sort of a general overview of the mental health services we offer.
Yes, that's super helpful. Thank you so much, Mary Jan. We have a question about the accessibility of Narcan and fentanyl strips. So I will speak just briefly about the accessibility issue, and then I'll ask Dr. Miller to talk a little bit about maybe what we're seeing on the fentanyl side. In terms of accessibility, we are about to launch 2 vending machine kiosks on campus that will sort of extend our services and availability of products that we have here in our pharmacy and in other parts, so that there won't be any barriers to students accessing these. They include things like sexual health, period products, cold and flu medications. They can get our STI test kits from these vending machines. And importantly, they offer Narcan and fentanyl strips. The strips are used to test any kinds of street drugs or other drugs for the presence of fentanyl. And then Narcan, of course, is a way of immediately treating someone who may have overdosed. It's very important to this campus and to campus leadership that there be no obstacles to these kinds of services. Some of them will come at no cost, like the Narcan and fentanyl strips and period products. And condom availability will be through these kiosks as well. Dr. Miller, could I just ask you to say something about the Narcan or fentanyl strips from a medical perspective?
Oh, yeah. So, I mean, it's just so important that that we make these available and, free to students, and they are, and really encourage, students to take advantage and to, come over and get some of the free supplies. I will tell you the probably the more common detection of fentanyl has been in students who are getting ADHD or other medications from the internet, not from a pharmacy, but from wherever. And then they test it, and some of the medications they get are laced with fentanyl. So I really encourage the students not to do this, not to get these medications from the internet, but they do. But the important thing though is that we make sure that they can test it, test any drug that they feel that they want to test. And as far as the Narcan goes, it's just such a good tool. You can save a life with it, and there's no reason for a student not to have it and to feel, empowered to help one of their friends. If Narcan is not, you don't use it on yourself, you use it on someone else, because that's how it works. Yeah. If someone is suspected to have an overdose and they are, obtunded, if they're passed out or whatever, well, then it's a very important tool for a friend, roommate, housemate, whatever, to have to help someone and to save a life. So I'm so happy that we have these here and that we're able to supply them to the students for free.
Thank you so much, Liz. A question came in about where these kiosks will be located. One will be outside the Student Health Center because they're so used to coming here for these kinds of products. The other will be outside of the student store in sort of a central location of campus. We're going to test this and see what the utilization is like and if it might be appropriate to bring on additional kiosks and place them in some of the colleges. Okay, the next question is for Dr. Lowe. Our daughter says that she thinks she may have ADHD. What are the steps that she needs to take, and how does she get the medications that she needs for that?
I don't think it's fair that I get all the easy questions. ADHD is a complicated problem, but I think just looking at some of the other questions here, I think it's so much in our culture nowadays, on social media, and in so many different ways we're talking about ADHD, and I think it is more prevalent. But here's the thing to keep in mind: ADHD is a description of what a person may experience. They are inattentive. They have a short attention span now. Lots of things cause ADHD besides the childhood genetic variety. So our job here in psychiatry at UCSC is to figure out holistically what are the different reasons that may be causing ADHD, not just jump to prescribing a medication. So if your child or you are concerned about their inattention, their short attention span, their difficulty listening in lecture, and if they're willing to spend time with one of us, going over all the possible reasons, exploring what their life is like currently, we are happy to do that. We do holistic treatment here of ADHD, and I would highly encourage it. I think that that's the healthiest way to go about treating it. My editorial comment here is that I think ADHD is treated too lightly nowadays, and there are many other services besides ours that do not treat it holistically and that will test and give a student a medication very quickly. If your student is only interested in that, we are not going to get in the way of that, but we don't follow that model of treatment, but we are happy to help your student find that model. If they really insist on a medication, or they've been on a medication before and that's all they don't want a holistic diagnostic process, or to explore other ways besides medications to treat ADHD. Our case management team or our own psychiatrists, we can help you and your student, find those resources. But I make a pitch for a holistic treatment of ADHD.
Thank you so much, David, and for taking such a strong leadership role on this at this campus and across the University of California. Dr. Miller, could you talk a little bit about the immunization requirements? Are we in a position to be able to give all the immunizations that a student is required to have, and do they need to have those before they come here?
Well, So number one, we prefer that they have them before they come here because the goal is to have a healthy campus, and it's better if you're, up to date on all of your vaccines before coming to campus. However, sometimes there are reasons why people are not vaccinated. And yes, we have all the vaccines. Students can make appointments for vaccines, individual appointments, or they can come to one of our vaccine clinics that we hold, several times a year. We also do travel medicine here, so we have all the travel vaccines, including yellow fever and Japanese encephalitis virus vaccine. But if every student came here unvaccinated, we would not be able to have the staff to do it. That's all we'd be doing. But so we really do encourage people to, do your best to get your student vaccinated before coming onto campus. But if they're not, they can contact us and we'll be happy to help them.
Thank you, Liz. There's a question that popped up around students who have SHIP and where they can get care while they're at home during breaks. And this is an important thing about, as I said, 55% or about 10,000 of our students have SHIP. It's important to note that it's part of the Anthem network, which is a national network. They have in-network providers through many parts of the country. But there are also out-of-network pricing that isn't too bad. And important to note that SHIP also has international coverage if your student is traveling abroad. Again, it's a really strong program, and so I'd encourage you, if you're not currently participating in it, to do so. And this might be an appropriate time to just say something briefly about dual coverage, so that if your student has something like Kaiser, where a lot of students opt out with Kaiser, it is not particularly easy to access Kaiser from this campus. There is not a local Kaiser facility in Santa Cruz. And even though it is kind of a significant expense, often students may be able to get their health coverage through their financial aid package, or if they're graduate students, through their student employment. So I'd encourage you to give a second look. And if you want to send more detailed questions about SHIP to that email address provided, which I'll put up again at the end, we're really happy to respond to those kinds of questions. Dr. Murphy, this question, you've gone over it a little bit in the past, but maybe say a little bit more about it. This parent is saying that their son refuses to see a therapist, but certainly and clearly is in need of some help, but just will not take advantage of the services we offer. What other kinds of things and services might they access on this campus?
Yeah, and I think that's a really common issue that happens, that therapy is not for them, right? Or they are not ready to think about therapy. And so we really respect that, because we want students to be ready to take that. So I think there were the few things that I did mention that I would like to maybe just repeat is the virtual anxiety toolbox, online programs that we have. We even have a program called TAO, which is Therapist Assistance Online. It's just getting connected, not even with a person, but getting onto a website and looking at all these modules they have on how to manage anxiety. So those are very, very important. I would recommend. We have the peer program in CAPS. We also have a peer program in our SHOP program. And that peer program focuses on mental health education. So one of the other options for students regarding anxiety is there's going to be educational programs throughout campus or at their college that they can attend that will talk about how to manage anxiety. And really, we may not be naming it as anxiety per se, but as how to get through school, right? How to manage my academics. And I think that's an important frame. Sometimes students don't want to think, oh, I have anxiety, I have depression. What we want to emphasize, and that could be good for parents and family to use as well, as want to just help you be successful in school. That's a little easier for students to think about. And last, some of our campus departments offer tutors. So sometimes the anxiety is about class and being able to keep up. And we have tutors on campus. We have tutoring programs on campus. Some of our advisors provide some of those services. So another way that a student is experiencing anxiety might start is to go to their department or to go to their advisor. And then, of course, we always have the Let's Talk and talking to peers.
Thanks so much, Mary Jan. There's a question about the wait time for CAPS services right now. Can you say something about that?
Yeah, we have the same day crisis service, so a student can always get in the same day if they're having an immediate crisis. A student can always get in the same day if they want what we call a consultation. They want to just come in and go, I'm stressed, but I don't know what would be helpful for me. And we find that that's really beneficial. And then in terms of an appointment, it's somewhere between 5 to 6 days to get an appointment. Right now that vacillates. So we usually can get most students in within the week.
Thanks so much. Dr. Miller, I think kind of one of our last questions, the question about, are we prepared to respond if COVID rears its ugly head again? And what kinds of things are we doing to prepare for that?
Well, COVID's here to stay. So we're not going to have another COVID-19 pandemic. We won't need to shut down due to COVID. Now we have vaccines and medications to treat COVID. I mean, it's still a big problem in the for elderly people and in the skilled nursing facilities, and of course, if you're immunocompromised, it's a problem. But we should look at it like flu. It's here to stay. We have antiviral medication to combat it if somebody needs it. And we will, give the support to students that they need if they need to isolate themselves and need a note for their classes or whatever, we can help them with that. But we, the bigger question is, if another pandemic, another epidemic comes along, are we prepared? And I would say definitely we are prepared. And we will work the way we did, with COVID. We'll work with the campus and with our local health department, with the other UCs and the UC specialists, and we'll do what we need to do to take care of the campus. But hopefully that won't happen again. And I just encourage everyone to make sure that, again, that the students are vaccinated, and especially against meningitis, both meningitis ACY and W. That's one vaccine, but meningitis B also is not a required vaccine, but it's a very important vaccine for students.
Thank you so much. And it's worth noting that UCSC, under the direction of Dr. Miller, was really out front and quickly responded in a massive way to the COVID crisis. The first campus of the 10 to set up testing, and it was really an impressive effort. And as Dr. Miller says, we stand ready should anything pop up again. That sort of brings us with just a couple of minutes. I want to ask the panelists if they have anything else they would like to add before we end. Okay, well, thank you. I'm going to put back up the email that you can use to send questions to. I want to thank our panelists. I think you can tell what a high level of expertise and care and compassion these folks have. And should your student need something, please be in contact with us. Have them come to us. We will do everything that we can to help. Thank you so much, and I hope you have a good day and a good week.